Okay, it's Dr. Buford. We're just getting started on this right shoulder. We're looking in from the back to the front. Everything that we see is magnified 30 or 40 times on the screen. We've got two cannulas coming in the front. First thing we're going to do is look at the biceps tendon over here to the right. Now I've slipped around it with the cannula there. And as we tug down on it, we can look. That looks fine. We can look at the anchor down below. And so you do not have a slap lesion. That looks like a pretty good biceps anchor. Looks like it peels back a little bit back here, doesn't it? But it doesn't look unstable right there. The rotator cuff is right above it, and that looks pretty good. A little bit of undersurface fraying right there, but I don't think that's really significant. We'll get a chance to look at the bursal side of the cuff in just a little bit. As we look around the back of the shoulder, we're going to start to see some of the things we need to fix. Here's the posterior glenoid, and here's this Hill-Sachs lesion. This area here that looks kind of orangish is what we call a Hill-Sachs lesion. That's what happens when the ball slips over the front edge of the socket, just like that. So see, when you dislocate, that creates a little dent in the ball right there, and then when it relocates, it sits right there. So we're going to have to fix, or use a little trick to fix that called a remplissage. And then the Bankart lesion refers to what happens. Give me a probe or a crochet hook. The Bankart lesion refers to what happens in this part of the shoulder right here. This detachment here is the Bankart lesion. So we're going to start with our work in the back, which means I'm going to switch the camera to the front. We'll go ahead and get that done and show you some more in just a minute. Okay, so here's the first anchor place. I just wanted to give you an idea of what it looks like. This is a triple loaded anchor. We're not going to use all three sutures. We are going to place a second anchor in though. And as we pull on this, you can see how just pulling on that one anchor reduces the humeral head. It's a pretty good shot of that, okay? So we're going to place another one in just a little bit. Okay, so now we've finished the remplissage part. We haven't tied the sutures yet, but now we've moved over to the front of the shoulder. And what we're about to do here is free up this anterior soft tissue. So this gives us a pretty good look. We'll keep working on this. And we'll show you some more in a little bit.